So I was quite fascinated by the statistics, right? I mean, a lot of the cancers are clearly preventable. I think most of the time they still go quite late to the doctors.
Correct. In fact, almost half of the cancers that happen, especially in India, are preventable. And secondly, it becomes much more important for Indian population to focus on prevention because the cost of cancer is very high. In general, healthcare costs are very high, and 80% of the healthcare costs are borne by individuals themselves. Government support has been lacking previously, and the way science is advancing, the cost of treatment is rising. So it makes economic sense also to focus on preventive lifestyle than reactive lifestyle when you have to treat. Another problem here in India is like we just don't care, we don't plan for health. It's an irony that we know that our health is going to deteriorate one day. We have seen it from ages that eventually health deteriorates, but we don't plan for ill health. We plan for marriages, we plan for education, we plan for honeymoons, everything, but we don't plan for ill health. So we don't want to spend money on health insurance. So, and when public is not interested, then why would the government be interested? So that's why the lifestyle part becomes a problem. Then we don't care. That's why the disease gets very advanced. 70% of cancers are diagnosed in later stages of disease, third stage and beyond. That makes the cure much more difficult compared to when you're, suppose, breast cancer. If we take, if you're diagnosing the patient in first stage or even second stage, up to 90% patients can be cured. This cure word we don't use normally in cancer, but some patients still can be cured. Especially if you have known family history, it is very important that you focus on the preventive aspect. Being proactive is important. Like I see like four advantages, four P's of even genomic testing or such an approach. Like where you can be proactive, you can have a preventive lifestyle, you can have a kind of a approach where you are able to predict. So prevention, prediction, preventive action early in time, a proactive approach helps you even save lives.
Absolutely.
So these tests, kind of tests, especially if there is family history, there are recommendations, scientific recommendations that you should go for such tests like genomic testing, where you would know that your blueprint, your DNA blueprint, is pointing towards a risk, an enhanced risk. And it's not like if you have that risk, it would definitely happen.
Exactly.
But at least if you know that you have that risk, you would have a preventive lifestyle. You would avoid any other triggers that may make it happen. Like in BRCA testing we do, not all BRCA positive
Exactly.
gene signatures would turn into cancer.
But at least they
At least they make those changes. They are more actively screening for the disease. They're having a better lifestyle, weight management, physical activity, and other factors. So you have to avoid other factors and minimize the risk. And that's the best investment that you can do in your health.